everyone. So for today, we will be discussing now the nursing role in caring for the family during pregnancy. This is a healthy or a normal pregnancy. And from our previous lecture, we have to recall, of course, the menstrual cycle. And doon sa menstrual cycle, no, there are several structures involved: hypothalamus, pituitary gland, ovary, uterus, and cervix. Going back to the stages or the phases of menstruation, doon sa cycle na kung saan phase is called ischemic phase, doon tayo mag-uumpisa to be able to say na merong growing fetus. Alright? Now, when there is of course, this occurrence, no, meron tayong tatlong iniintay na stages. Okay? Fertilization, implantation, and the rest is fetal development. Okay, again, doon sa ischemic phase, si egg, mature na siya, waiting for the sperm. And also, si sperm, no, nandoon na siya sa reproductive organs ng babae at dapat mature din siya. Okay? That is the ischemic phase. And in the ischemic phase, andun din yung ibang structures na importante. Yung corpus luteum, natutulong magpanatili ng hormones, and also the thickened endometrium. Alright? Now, this is how fertilization will occur. Usually, no, only one of a woman's ova will reach maturity each month. Okay? Fertilization must occur fairly quickly because an ovum is capable of fertilization for about 24 hours only. 48 hours the most. On the other hand, because the functional life of a sperm is also about 48 hours, possibly pwedeng 72 hours, the total critical time span during which sexual relations must occur for fertilization to be successful is about 72 hours, no? Or 48 hours before ovulation plus 24 hours afterward. Okay, so dyan makikita nyo, si egg mature at si sperm mature din. Okay? Now, looking at this photo, alright, ang unang-unang titignan nating picture is this one. The first thing that happens, number 1. Later on, number 2, and then yung number 3. So, dito muna tayo. Alright? This is the ovary, the fallopian tube, and the uterus. Okay. Ito yung napakaraming immature egg cells sa ovary. Alright? And then, mature egg is set free from the surface of the ovary. So, lumabas siya. Ito siya. Okay? Ayan siya. No, it's a single mature egg that is set free from the surface of the ovary. Nagkaroon kasi ng ovulation. It's propelled into the ampulla part, no, of the fallopian tube because may fimbriae. Yung fimbriae, yan yung mga hair-like structures dun sa end ng fallopian tube na parang may current. Hinihigop nila yung egg palabas. Second, kaya nakarating dyan yung egg from ovary to ampulla is because of the peristalsis of the tube. And third, meron ding cilia dyan sa fallopian tube. Okay? So, mature na siya. Now, look at this egg. Yung dark na area or the shaded circle which is color blue, yung pinaka nasa gitna. Okay? It's a ring of mucopolysaccharide fluid. At ang tawag natin dyan, zona pellucida. Ngayon, yung egg na yan ay nababalutan nung circle of cells. So, yung parang outer circle sa labas. Okay? And that circle of cells is called corona radiata. Again, yung nasa loob na circle, yung shaded na blue, it's a ring of mucopolysaccharide fluid called zona pellucida. Yung outer ring, yun yung circle of cells, it's called corona radiata. Yaan yung isang mature egg. At anong stage ng menstruation, meron tayong ganyan, ischemic phase. Okay? Now, eto na siya ngayon. With sexual intercourse, nagkaroon ng ejaculation. So, yung mga color blue na madami, nagta-travel, is actually your sperm. Normally, a 2.5 ml semen contains 400 million sperms, about 50 to 200 million per ml. Sperms can reach ovum within 5 minutes after deposition. Alright, so mabilis. Ngayon, ang sperm kailangan mag-undergo ng final process. Ang tawag doon, capacitation. C-A-P-A-C-I-T-A-T-I-O-N. It's the final process a sperm must undergo to be ready for fertilization. Okay? When does that happen? It happens as sperms move toward the ovum. Anong nangyayari sa kanila? Nagre-reveal sila ng sperm binding receptor site in the sperm's head. Ibig sabihin, as they undergo capacitation, para silang nagkakaroon ng mga sticker sa ulo. Okay, yun yung sperm binding receptor site. A sperm contains a head and the tail is called a flagella. So, kita naman natin yung itsura niya, no? May head at may tail, which is the flagella. So, as they undergo capacitation, nagkakaroon sila ng sperm binding receptor site in the head para sila nagkakaroon ng sticker dun sa mga ulo nila, no? They undergo that capacitation as they travel towards the ovum. All sperms that reached capacitation will now cluster around the egg. Okay? Pupunta yan, makakarating ng egg, magta-travel. So, kita naman natin dyan, nagta-travel siya. Paano siya nakaka-travel? Sperms travel through, number one, they have a tail. So, may flagella sila to help them swim. Second, ano nga yung diniscuss natin about the changes in the cervical mucus? Yung cervical mucus na pinagsiswimmingan nila, naging thin and watery. And third, meron din kasing uterine contractions that help them as they travel toward the egg, as they meet in the ampulla. So if you look at the two, obviously, mas malayo yung tina-travel ng egg compared dun sa dapat i-travel ng sperm. That's why these sperms should be good swimmers. Alright? Now, as they reach the ampulla, we now go to the second picture. Okay? As they reach the ampulla, they have to cluster around the egg. Okay? Kita nyo naman, di ba nga, meron silang sperm binding receptor site sa ulo. So, kung meron silang sticker dun sa ulo nila, didikit sila dun sa layers ng egg. Okay? Once they stick their head into the layer of the egg, they will release a proteolytic enzyme that will dissolve the layers of the egg. So, pag dumikit doon si sperm sa layer ng egg, magre-release siya ng hyaluronidase. Alright? Hyaluronidase is a proteolytic enzyme to dissolve the layers of the egg. That is one reason why ejaculation must contain millions of sperms. It is to provide sufficient enzymes or sufficient hyaluronidase to break the layers of the egg. Specifically, yung outer layer which is corona radiata. Kaya minsan, merong mga hindi nagkakaroon ng successful fertilization kasi merong kulang na sperm count. Pero in reality, ang kailangan lang naman talaga na mag-combine sa egg is one sperm. But why do we need millions of sperms? So that when they stick their head to the layer of the egg, mas maraming hyaluronidase, mas maraming makaka-break ng corona radiata. Okay, which is depicted in picture number 2. Now, if one sperm will successfully penetrate inside, especially the zona pellucida, siya yung kauna-unahang nakapasok hanggang sa loob. The egg will have a chemical reaction. No other sperm can enter. Pag nangyari yon, one egg is to one sperm, they combined, and that is fertilization. Okay, number 3. At meron kang product. Ano yung product ng fertilization? Zygote. So again, only one sperm for one egg. An exception is called H-mole or hydatidiform mole. It's an MCN2 topic, no? Nabuntis yung babae, may nag-combine din naman, pero yung isang egg, maraming sperm ang nakapasok. Hindi mabubuo yung fetus. Alright? It's an abnormal pregnancy, which we will discuss later part, which is for second semester. So in H-mole, there is multi-sperm entrance. And that leads to an abnormal zygote formation. But let's focus first dito muna sa 1:1. Paano po nangyayari ang multiple pregnancies? No? Ang multiple pregnancies is different from H-mole. Kasi kailangan one egg is to one sperm. Ang H-mole, one egg is to multiple sperms. So, yung mga kambal, triplet, no, kapag fraternal, posibleng itong right ovary, 2 o 3 yung nirelease na mature egg. And normally, isa lang. So, kung mas marami yung nirelease na mature egg, yung sperm, i-fertilize yung 1, 2, or 3 na nag-release na mature egg. Okay? Pero kung identical yan, galing pa rin siya sa iisang egg, iisang sperm na nag-unite, and then as they go along and develop, dun sila naghiwalay into 2 different entities, 2 or more. Okay? O kaya, itong right ovary nag-release ng isang mature egg, which is normally ganon. Samantalang yung left ovary doon, meron din siyang release na isang mature egg. But then again, one egg is to one sperm pa din. Okay? Fertilization has been achieved now kapag nag-unite na yung isang egg and isang sperm. And immediately after fusion, the chromosomes form a zygote. Yun yung product ng fertilization, carrying either XX chromosome, babae siya, or XY chromosome, lalaki naman yung fetus. Okay? So, again, these are the 3 important factors necessary for fertilization to be successful. Una, mature si egg. Pangalawa, mature si sperm, no? Second, ability of the sperm to reach the ovum. Malayo kasi yung itatravel ni sperm, kailangan kaya niyang makarating mula dun sa vagina, which is the site of ejaculation, until or up until the ampulla portion of the fallopian tube. And third is the ability of the sperm to penetrate. nakarating nga siya doon sa egg, pero hindi naman niya kayang ma-penetrate yung egg. So, kailangan niya ng tulong ng iba pang sperms when they release hyaluronidase because they are capacitized. Okay? Now, the second part is how implantation happens. So, again, dito sa photo na ito yung ovary, ito yung na-release na egg, may dumating na sperm, nag-combine sila, naging zygote. So, ito na si zygote. Nandyan siya sa ampulla part. Alright? In 3 to 4 days, that zygote will migrate toward the uterus. So, ang under niya, papunta dito. Okay? Hindi siya dapat bumalik. Magmamigrate siya towards the uterus. As it travels, of course, nagkakaroon ng mitosis. It's a cell. So, it divides. In about 3 to 4 days, para ng grapes yung itsura niya. Kasi nagdi-divide siya eh. There are about 16 to 50 cells. Ang tawag na dyan, morula. Okay, now, additional 3 to 4 days. Yung morula, nagta-travel siya hanggang uterus. So, pagdating niya ng uterus, iba na naman yung itsura niya. There is already an inner cell mass. So, yung inner circle, no, that's the inner cell mass. We call it embryoblast. And then yung outer fluid, yung outer circle, ang tawag naman dyan, trophoblast. Okay, together, yung structure na yan, ang tawag dyan, blastocyst. So, from a zygote, right after fertilization, naging morula in 3 to 4 days, 16 to 50 cells, and again, after another 3 to 4 days, naging blastocyst na siya. And by that time, ang blastocyst nasa uterus na. Ang blastocyst may inner cell mass, yun yung embryoblast. May outer fluid, yun yung trophoblast. Alright? Ngayon, yung embryoblast na yan, in the future, siya yung magiging embryo at magiging fetus. Siya yung magiging baby. Si trophoblast naman, no, yung outer fluid, in the future, siya yung magiging placenta, umbilical cord, membranes, and all the other products of conception. Okay? So, ito na nga si blastocyst. Ayan na siya. Pagdating niya ng uterus, mapapansin niya ano yung characteristic ng endometrium at this time. Yung endometrium at that time, makapal. It's thick. Remember, it has thickened because of the menstrual cycle functioning ng LH, it thickens the endometrium. So, ang blastocyst, nung nakita niya na may thick endometrium, that's about after 8 to 10 days nung nasa uterus na siya, meron siyang tatlong gagawin. Okay, ano yung tatlong gagawin niya? Una, that blastocyst will brush itself in the endometrium. Pangalawa, it will attach itself. At pangatlo, it will settle down there. Okay? Brushing, attaching, and settling down. Okay? Isisiksik niya yung sarili niya, ididikit niya yung sarili niya, at magsisettle down na siya doon. Brushing, attaching, and settling down. In other words, apposition, adhesion, invasion. So, yung tatlong yun yung tatlong proseso para yung blastocyst, itanim niya yung sarili niya doon sa thickened endometrium. Ito yon, yung structure na yan. And what has happened after that? Nangyari na ang implantation. Okay? So, ang implantation, should happen in the upper posterior surface of the thickened endometrium. Nasa bandang taas at nasa bandang likod. Okay? Because if it is low, it may occlude the cervix and cause another high-risk pregnancy, which we will discuss again sa MCN2. Ang tawag doon, placenta previa. Okay? Also, kasi 'di ba may nangyaring brushing, attaching, and settling down doon sa thickened endometrium. Because of that, a small amount of spotting may occur as capillaries rupture from the implanting trophoblast. Diba? Nag-brush, nag-attach, nag-settle. It's a thickened endometrium and endometrium sheds off. Kaya pag nangyari yung implantation, posibleng yung babae maka-experience ng small amount of spotting. Maaari niya yung ma-mistaken for a scant menstrual flow. Pero hindi dapat. Okay? Kasi patak-patak lang naman yun, tapos halos hindi naman yun aabot ng isang buong araw, no? Most probably, that is implantation. Okay? Now, once implantation has happened, yung blastocyst na implant na siya, no? Si embryoblast, ang tawag na sa kanya, embryo. Okay? Another, si endometrium, may na-implant ng structure. Alright? And an endometrium, once implantation happens, already becomes the decidua. So, ang may decidua lang ay yung babae na buntis na. Decidua is an endometrium na may na-implant. Ano yung na-implant? Yung blastocyst. At si blastocyst, kapag na-implant na siya, yung embryoblast na inner cell mass is already called embryo. Siya yung magiging future baby. At yung trophoblast, yung outer fluid, siya yung other products of conception. Okay? Now, another photo, no? Let's see. Fertilization happened in the ampulla. Nagkaroon ka ng zygote. No, mga 16 to 50 cells na siya within the fallopian tube, nagta-travel, it's a marula. Pagdating niya ng uterus, blastocyst na siya. Blastocyst, inner cell mass, embryoblast. Nung na-implant, embryo, future baby, outer fluid, trophoblast, other products of conception. Okay? Implantation happens about 7 to 10 days or 1 week after fertilization occurred. Okay, that's also another photo. Again, pag na-implant na, ang tawag na doon sa batang nabubuo, embryo. Up until 8 weeks. Kasi kapag naka-8 linggo na yung embryo, pwede mo na siyang tawagin na fetus. Okay? This is the decidua. I mentioned a while ago that the decidua is the endometrium that has been implanted on. It continues to grow in thickness and vascularity. So there are 3 layers, the basalis, the capsularis, and the vega, or the vera, I mean. Basalis is directly under the embryo. Capsularis, it stretches and encapsulates the trophoblast, and the vera is the remaining portion. Okay? So another photo showing the decidua. Alright, the third and the last and the longest sa lahat nung iniintay nating growing fetus ay yung fetal development from the inside. Okay? But aside from the fetal development, nagde-develop din yung other products of conception. Unahin natin yung structures na na-form from the trophoblast. Okay, si trophoblast, it becomes chorionic villi, placenta, membranes and fluid, and umbilical cord. Wala dyan si fetus kasi si fetus ay galing sa embryoblast. So first is the chorionic villi. The blastocysts that have been implanted will receive nourishment from the endometrium. Okay? So, na-implant na siya, di ba? Kukuha siya ngayon ng communication sa endometrial blood vessels. Okay? Ngayon, as this trophoblast gets communication, nag-form siya ng unity with the maternal blood vessels from the endometrium, no? Unti-unti, nagre-resemble siya ng probing fingers and they start its own layer of cells. Gumagawa siya ng sarili niya ngayon na layer ng cell. Okay? At ito, yung tinatawag natin na chorionic villi. Villi, maliliit na blood vessels. Okay? Na unti-unting binubuo para in the future magiging placenta siya. But initially, nanggaling siya sa trophoblast na na-implant na nag-receive muna ng nourishment from the endometrial blood vessels, nag-communicate hanggang gumawa siya ng single layer of cells. Okay? So, ngayon, ito na si chorionic villi. Meron siyang central core of connective tissues and fetal capillaries kasi nga maliliit siya na blood vessels. Yung syncytial layer or your syncytial trophoblast is the outer layer. Okay? Gumagawa siya ng HCG or human chorionic gonadotropin, estrogen, progesterone, somatotropin, or human placental lactogen. Okay? Later on, we will discuss further ano yung mga hormones na yan at ano yung mga importance ng hormones na yan. The second layer or the middle layer is the Langhans layer or the cytotrophoblast. It protects the growing embryo and the fetus from infections, lalo na yung mga syphilis infections. But it is only present until 20 to 24 weeks because by 20 weeks, fully functional na at buo na yung placenta. Kaya wala na yung layer na yan. Okay? Chorionic villi will become the future placenta. Ito na si placenta. The placenta arises out of the continuing growth of the trophoblast tissues, yung chorionic villi. So, meron na siyang sariling network of blood vessels, arteries, veins, and capillaries. It's fully formed at about 20 weeks and weighs about 1 pound. So, halos kalahating kilo ang isang placenta. At dahil buo na siya at 20 weeks, andito na yung blood supply na panggagalingan ng lahat ng kailangan ni baby, no? Pati yung mga waste products niya, yung significance ng function ng placenta, it serves as the life of the baby or the fetus. Kaya nga kapag buong-buo na siya at 20 weeks, yung pagbubuntis ng mommy ay tinatawag na nating age of viability. Pag sinabing viable or viability, mataas yung chance na maging successful ang pregnancy na ito, mabubuo siya, magiging successful, ipapanganak ng healthy at maayos yung baby. So, yung age of pregnancy viability is 20 weeks or more. Okay? So, ano yung 20 weeks pregnancy? It's about 5 months pregnancy. And that is in the second trimester already. Okay. As number of chorionic villi increases, no, intervillous spaces grow. Okay? Ayan yung mga intervillous spaces. And they are actually divided by partitions called cotyledons. At term, halos may 30 cotyledons na. So, pag kayo nagpaanak, lumabas yung placenta, you will check the completeness of the cotyledons. Okay, but anyway, that's in labor and delivery pa. Now, the placenta, as what I've said, is fully functional at 20 weeks, and it has a very significant function to the fetus, to the growing fetus. First is circulation, and second is endocrine. Okay? Now, yung mga cotyledons din na yan, no, these are the reasons why the maternal side of the placenta look rough and uneven. But the fetal side of the placenta is actually smooth and even. Okay, the maternal side is dirty looking, the fetal side is shiny looking. Okay, so this is the circulation, no, from the placenta going to the baby. Yung mga kulay pula, sila yung nagdadala ng oxygenated blood. At yung blue, sila yung nagdadala ng unoxygenated blood. So basically, the placenta causes or functions for blood exchange. Ano yung nag-exchange? Oxygen and nutrients na kailangan papasok kay baby, at yung waste products na ginamit ni baby palabas naman sa kanya. So nanggagaling ang oxygen and nutrients from the placenta, itinatapon naman ang waste products to the placenta. Okay? Now, endocrine. So this is what I was telling a while ago about the different hormones. Initially, no, yung corpus luteum, nagpapanatili siya ng mataas na hormone. Sunod doon, nung nagkaroon na ng chorionic villi, siya na yung nag-umpisang mag-produce ng mga hormones. Hanggang sa maging fully functional na placenta na siya, sobrang mataas na yung hormones ng babae. For pregnancy to be successful, kailangan niya ng mataas na hormones. One is HCG, or human chorionic gonadotropin. It is the first to be produced, no? Corpus or chorionic villi pa lang, no? Trophoblasts pa lang actually, nagpo-produce na ng HCG. And that HCG allows chorionic villi, corpus luteum initially to produce more estrogen at progesterone. And at about 8 week or less, no? And then hanggang sa magkaroon na siya ng patuloy na magpag-produce ng mas maraming hormones hanggang magkaroon na siya ng placenta. Okay? So by the time the placenta is fully functional, yung HCG nagde-decrease na siya. Kasi nga yung corpus luteum hindi na siya necessary, because the placenta now produces more estrogen and progesterone. Because HCG is the first to be produced, trophoblast pa lang meron na niyan. Kaya ito yung unang-unang madedetermine if you are pregnant. HCG can be detected in the urine. Kaya doon sa pregnancy test, no, pag nakakita ng HCG level doon sa ihi, no, pag na-detect through the kit, you are probably pregnant because only trophoblasts produce it. Okay? And you will not have a trophoblast kung wala kang zygote na na-form at blastocyst na na-implant. Second is estrogen. It's important na continuously tataas siya. It's important for breast enlargement as the woman starts to produce milk, no, and uterine growth. That's very important because you need uterus to expand to accommodate the increasing size of the baby. Third is progesterone. It maintains endometrial lining, manatiling makapal yung layer ng matres, no? And progesterone is also important because it quiets the muscles of the uterus. The uterus contains 3 layers, Endometrium, myometrium, perimetrium. Endometrium, dyan kumabit, dyan na implant, no? Yung trophoblast hanggang nagkaroon ng placenta. Yung myometrium, from the word myo, it contains muscles, and muscles contract. But these muscles should only contract during labor. What about during pregnancy? During pregnancy, hindi sila pwedeng mag-contract. Otherwise, meron kang premature labor. Pag nilabas mo yung baby nang immature siya, hindi niya kakayanin ang extrauterine life. And the progesterone quiets the myometrium hanggat hindi pa kailangang humilam. Okay? Fourth is HPL, human placental lactogen, or minsan tinatawag din siyang somatomamotropin. HPL is also for breast enlargement. HPL is milk producing. And it also regulates the maternal nutrients to be available also to the fetus. So, ang pag-produce ng milk katulad ng prolactin, if you remember before. Yung prolactin, it's a hormone of the anterior pituitary gland. Nagpo-produce siya ng milk. Katulong niya yung HPL ng placenta. Okay? Next are the membranes and the fluid. So, ito, yung chorionic villi nung umpisa, naging functional placenta at 20 weeks. Okay? Now, the chorionic villi on the medial surface of the trophoblast, those that do not actually touch the endometrium, yung layer na hindi lahat dumikit, no? They gradually thin. Eventually, they become a sac. And that sac is called chorion. So, ito siya, yung outer sac. So, galing pa rin siya saan? Dun sa chorionic villi. Okay, that outermost fetal membrane is called the chorion. It's basically for protection. At pangalawa, there's another sac. The inner sac, yung pangalawa. And that sac, no, it forms beneath the chorion, and that sac also produces amniotic fluid and phospholipids. Alright? Mamaya, ipapaliwanag natin ano ang function ng amniotic fluid and phospholipids. Ang gumagawa niyan, amnion. Alright? Sino yung nasa loob niyan? Kasi it's a sac. If you say sac, may laman sa loob. No? Nandiyan nga yung phospholipids, amniotic fluid, pero ang pinaka-importanting nasa loob ng sac na yan ay yung nagde-develop na fetus. Alright? These sacs that came from the initially chorionic villi, they have no nerve supply. So when they spontaneously rupture at term, or if they are artificially ruptured, no, pag pinapanganak na, puputok yan, pumutok yung panubigan, my water bag broke, so the sacs ruptured. Because they don't have a nerve supply, neither the mother or the child will experience any pain. Okay? So, ito na nga yung chorion and amnion. So, ayan yung sac, yung outermost layer, chorion, yung innermost layer, amnion. Alright? The chorion supports the sac. The amnion produces amniotic fluid and phospholipids. Amniotic fluid, it is slightly alkaline, and the average amount at term is between 800 to 1,200 ml. If you hear the word term, if you encounter the word term or full term, it's the same. Term or full term. Ibig sabihin lang nun, the baby is mature enough to cope with extrauterine life. Pwede na siyang lumabas. Kakayanin na niya yung walang placenta. Kasi mature na yung organs niya. Kailan ang term? Okay? 37 to 42 weeks. 37 to 42 weeks na ipinanganak. Ngayon, may mga librong magsasabi 38 to 42. Okay? So here, we consider 37 to 42 weeks as term. Ano naman ngayon kapag yung 20 weeks nga, yung baby, pag 20 weeks na siya, viable na siya. Pero pag between 37 onwards, term na siya or full term. Okay? Bakit may hanggang 42? Kasi pag umabot pa yan ng 43, post-term na siya. Okay? Hindi rin maganda yung post-term. More than 43 weeks na, hindi pa lumalabas. Actually, pag lumagpas ng 40 weeks, hindi pa lumalabas, nilalabas na natin dapat siya. No? Tinutulungan na nating makalabas yung baby. Bakit naman ganon? Kasi yung placenta, yes, nandyan siya, mature, pero may expiration date ang placenta. It's only up until 40 weeks for best results. So, kung nandun pa yung baby sa loob, hindi pa lumalabas, sobra-sobra na yung kanyang age of gestation, no? Yung placenta, hindi na siya ganun kagaling mag-function. So anyway, pag sinabing term, 37 to 42 weeks. Halos 1 litro yung amniotic fluid sa loob. What are the functions of the amniotic fluid? Because it's a liquid, no? It shields all products of conception against pressure and blow. It also protects the fetus from temperature changes. And the amniotic fluid also aids in muscular development. What about the phospholipids also produced by the amnion? Ang phospholipids, they form prostaglandins. At the end of the pregnancy, mas maraming phospholipid, mas maraming prostaglandins. Ano ngayon kung maraming prostaglandins? Prostaglandins initiate uterine contraction. And by the end of the pregnancy, pag marami na yan, mature na yung baby, isa yan sa theories bakit nag-uumpisa ang labor. Okay? Next is the umbilical cord. So again, no? Ito na yung choreo na na-form. Ayan na yung placenta, chorionic villi initially, na naging placenta na siya at 20 weeks. And then, yung chorionic villi na hindi nagamit, nag-thin, naging sac, chorion, amnion. And then, sa loob, no, nung sac, nandoon yung fetus, nandoon yung amniotic fluid, nandoon yung phospholipids, okay? Ito ngayon si umbilical cord. Umbilical cord is formed from the chorion and the amnion, no? Na nandiyan as it connects the embryo to the chorionic villi of the placenta. So siya yung pusod, nagdudugtong. The umbilical cord contains big blood vessels, pero 3 lang yung blood vessels sa loob niyan na malalaki. There are 2 arteries carrying unoxygenated blood from fetus to placenta, and 1 vein carrying oxygenated blood from placenta to fetus. Okay? So this is the chorionic villi with larger veins and arteries. They form the umbilical cord. Yung bulk ng umbilical cord is a gelatinous mucopolysaccharide, and we call that Wharton's jelly. Yung Wharton's jelly, no, kaya may parang smooth and glistening appearance yung cord. And it also prevents pressure on the vein and arteries that pass through it. So, kitang-kita mo dyan, 2 arteries, no? Parang kulay puti lang siya, oh, and 1 vein, pulang-pula. Bakit? Yung arteries kasi, ang daladala niya ay unoxygenated blood. Movement of blood there is away from the baby. Okay, specifically away from the baby's heart. Yung umbilical vein naman, it's super red inside. Okay, kasi ang dala niya ay oxygenated blood. Ang andaran ng dugo dyan is towards the baby. Kasi saan galing ang oxygenated blood? From the placenta, going to the baby. Okay? Yung outer surface ng umbilical cord is actually covered with amnion. It also has no nerve supply. That's why you can cut it without discomfort to the mother or the child. Okay? Functions, again, transports oxygens and nutrients from placenta to fetus. Okay? So, pag sinabing from placenta to fetus, ano kaya ito? It's the umbilical vein. Yung nagre-return naman ng waste product from fetus to placenta, ano kaya ito? Ito naman yung dalawang umbilical arteries. Okay? Ngayon, no, ang kulang na lang sa lahat ay yung pinaka-importanting product of conception, which is your fetus. Okay? So again, yung placenta, nandyan na, yung chorion, amnion, the fluid, phospholipids, umbilical cord, nandyan na siyang lahat. Yung kulang na lang yung embryo na na-implant. Habang nangyayari lahat yan, unti-unti rin nang de-develop si embryo. In fact, siya yung pinakamatagal mag-develop sa lahat. Hanggang siya ay maging fetus, hanggang siya ay maging term. At gaano nga katagal yung iniintay natin para yung na-implant, yung embryo, ay maging mature, 37 to 42 weeks. Okay? The due date is actually 40 weeks. Alright? Ang babaeng buntis ay buntis talaga for 10 months. 10 lunar months. And 10 lunar months is 40 weeks. No? Meaning, fetus is mature enough at that time, at 40 weeks. Kaya yun yung due date. At paano natin binibilang ang ika-40th week? Of course, we go back to day 1. At ano nga yung day 1? LMP. It's the first day of the last menstrual period. Now, yung maturity na yan, it resonates within the entire month, which is the entire 10 months or the 40th week. No? It resonates the entire month surrounding the 40, which is 2 weeks before and 2 weeks after. Meaning, 38 weeks hanggang 42 weeks. Pero nga, di ba, we adjust 37 weeks. Sinasabing, mature na rin yung fetus na yan. Kaya nga, 37 to 42 weeks. Pero exactly, ano ang due date? Pag sinabing due date talaga, it's actually the 40th week. Okay? Now, yung 37 weeks, mature na rin naman pala si baby niyan. Ibig sabihin, at 37 weeks, pwede na rin mag-initiate ang labor. And that's true. Meron talagang mga babae, 37, 38 weeks, nanganganak na. Yun nga yung usual. And the 37th or the 38th week always falls on the 9th month, not on the 10th. No? Kaya nga, halos kadalasan, ang alam nila, or kadalasan, ilang buwang buntis yung nanay, yung 9 months. But in reality, it's actually the 40th week. But resonating 2 weeks before, 2 weeks after, mature na rin yung baby, kaya nasa pagitan siya ng 37 to 42 weeks. Okay? So again, what are these terms that is important to know when we talk about fetal growth? Ovum, yan yung mature egg. Pag na-fertilize na siya ng sperm, zygote na. Okay? Yung zygote, no? 'Di ba? Magde-develop morula, blastocyst. Yung blastocyst, yun yung nai-implant. So pag tinanong kayo, anong structure ang nai-implant? Blastocyst. Ang blastocyst may parts. Trophoblast, outer fluid, siya yung magiging future placenta, umbilical cord, etc. Si embryoblast, siya yung magiging future fetus. Si embryoblast, pag na-implant, or specifically the blastocyst, pag na-implant siya, ang tawag na kay baby embryo. Pag siya ay naging 8 weeks na or 2 buwan nang naka-implant yung embryo, fetus na siya hanggang ipanganak siya. Okay? Or conceptus. It's the developing embryo or fetus and placental structures throughout pregnancy. And another term is the age of viability, meaning the earliest age at which fetuses could survive kahit na ilabas mo sila ng ganong age. No? They could survive. Kakayanin na nila kahit papaano. Okay? And generally accepted is 24 weeks, but we regard it as 20 weeks. Okay? Or yung laki o timbang ng fetus, at least kalahating kilo na siya. Okay? These are the facts of life. The facts of life are the 10 lunar months that we encounter or that we check per month kung paano nagde-develop ang baby buwan-buwan. Okay? First lunar month, mga germ layers yan. Mesoderm, endoderm, ectoderm. It's self-explanatory. Para lang tayong maliit na microchip noon. Diyan nanggagaling lahat ng body system natin as we grow old. Okay? So, no first lunar month, rapidly growing, spinal cord nag-form and fuse at the midpoint, head nagiging prominent, back is bent, kaya nga 'di ba ang fetus para tayong letter C, no? Paglabas ng baby naka-bend yung back natin because as we do that, we are smaller. And if the fetus is smaller, it's easier for the mother to give birth. Nandiyan na rin yung rudimentary heart, no? May fetal circulation, may fetal hemoglobin. Okay? Nandiyan na rin yung rudimentary eyes, ears, nose, they are discernible. So, ganyan lang siya kaliit. Second month, lumalaki na, nagiging 1 inch. Organogenesis is complete. Ibig sabihin, nandiyan na yung organs. Na-develop na yung organs, but not necessarily na mature siya. The heart actually beats at 2 months. May genitalia na, pero hindi pa siya ganun kakita. Primitive tail undergoing retrogression from anatomy. If you recall, no, yung ating spinal cord, cervical, thoracic, lumbar, sacral, coccyx. Di ba yung sacral and coccyx, nag-fuse na lang siya as you are actually born. Pero noon, mahaba yan. Bakit mas mahaba siya nung fetal life? Kasi 'di ba, like a building, para maging matibay ang building, kailangan unang tinatayo yung mga buto. Okay, yung matitibay na foundations. Abdomen appears large. Sa ultrasound, which is sonogram, there's a sac. But you cannot really see in the ultrasound na may baby na. Just a sac. Okay? Third lunar month, so yan yung length and weight, capable of spontaneous movement though not felt by the mother. Gumagalaw na yung baby, no, may movement na yung kamay at paa, pero hindi maramdaman ng mommy kasi compared to the size of the uterus, maliit pa masyado si baby para ma-discern ng mommy na may movement. Meron na rin reflexes. What are reflexes? Reflexes are signs, or these are reflexes that will tell you the neuromuscular system is functioning well. So, mas pag-aaralan natin ang reflexes sa newborn. Yung Babinski reflex, yan yung paa ni baby, no? Nagpa-fan out pag nasi-stimulate siya. Okay? Especially kung ito yung talampakan, no? Pag ginanyan mo, nag-slide ka na parang letter J doon sa talampakan ng baby, gaganyan siya. Okay? Para siyang nakikiliti. Ma'am, nakikiliti din naman ako. Pero hindi Babinski yun. Hindi siya reflex. Sila, they fan out. Like that. Okay? Paano nangyayari yun doon sa loob ng uterus? Hindi naman sila nakikiliti because they are capable of movement. So, yung talampakan ng baby as it moves, kapag may natatouch siya, most probably na ibang body parts niya, makikita mo nagfa-fan out yung feet ng baby. So, meron siyang Babinski reflex. Ossification of bones and tooth buds have formed. Kidney secretion has begun. Umiihi na yung fetus, no? At saan siya sumasama? Obviously, sa amniotic fluid. And dito, pwede mo nang marinig ang tibok ng puso. Pero audible lang siya by ultrasound or a Doppler machine. Okay? 4th lunar month, syempre mas lumaki. This time, pag 4th month na ni baby, pwede nang marinig ang fetal heart tones even with just stethoscope. Okay? May lanugo na rin nagfo-form. Ano ang lanugo? Fine downy hair. Parang mga buhok-buhok, lalo na sa likod, no, na maliliit, maninipis. Okay? Ang lanugo, tumutulong yan just to control the fetal temperature. Buhok siya eh. Pero, pag mature na yung baby, nawawala yung lanugo. I mean, fetus. No? Unti-unti siyang nauubos. Kaya dapat, pag linabas ang full-term baby, wala kang makikitang lanugo. Lalo na sa back. Lanugo in a newborn baby is a sign of prematurity. Okay? Liver and pancreas are functioning and 4th month, lumulunok na ang baby. So, anong nalulunok niya? Yung amniotic fluid. Di ba sa amniotic fluid, nung 3rd lunar month, kidney secretion has begun. So, meron ka ring mga nalulunok na urine. Okay? What happens pag nalulunok mo na yung nasa loob? Yung fetus, nalulunok niya yung amniotic fluid na may urine or other fluids there. Nothing happens because the fetal lungs are not functioning. Okay? What happens? Paano sila nagkakaroon ng oxygenation? Galing yung oxygenation sa placenta. Dumadaan sa umbilical cord via umbilical vein. So, kahit nagsaswallow si baby nung pinagsiswimmingan niya sa loob na amniotic fluid and other fluids, nothing happens. Okay? 5th lunar month, so mas humahaba, mas bumibigat. Here, the mother can feel the movement of the baby. If the mother feels the movement of the baby for the first time, you call it quickening. Okay? And it's a developmental milestone. It's a milestone of fetal development kasi naramdaman ng nanay, meron talagang nabubuo dun sa loob ng uterus niya. Antibody also is starting to be produced. Meconium is present. No? Meconium, ito yung unang stool or pupu ng baby. Now, this is totally different with that of urine. Ang fetus umiihi sa loob ng uterus, pero hindi dapat siya nagpupupu. Okay? Si meconium nandyan lang sa intestines, pero hindi niya yan dapat nilalabas. Why? The rectal sphincter should remain contracted intrauterine life. Okay? Kailangan lang mag-relax ng rectal sphincter paglabas ng baby. Kaya dapat walang meconium sa amniotic fluid. Pag nangyari yon, which is actually true, it really happens. May mga fetus nasa loob pa lang ng tiyan ni mommy, nagre-relax yung rectal sphincter. Pag nag-relax yung rectal sphincter, lalabas yung meconium. Pag lumabas yung meconium, nalulunok ng baby. Okay? Anong magiging problema? Pag nalunok ng baby yung meconium, sa loob ng katawan ng uterus, walang problema kasi hindi naman siya doon humihinga sa placenta. Pero paglabas ng baby, merong malapot na meconium na humarang sa airway niya. Doon siya makakaproblema. Kasi yung amniotic fluid na normal, malabnaw lang siya. The alveoli is capable, the alveoli is designed to slowly absorb the amniotic fluid, which is malabnaw. Pero pag nahaluan siya ng meconium, lalapot. Yun yung hindi kayang i-absorb nung neonatal lungs or the alveoli. So magkakaroon ng posibleng respiratory distress. Sa anong pagkakataon pwedeng mag-relax yung rectal sphincter ng fetus? Any kind of respiratory distress or any kind of neonatal distress inside the uterus. Okay, so pwedeng nagka-problema dun sa pagbubuntis ng babae, nagkaroon ng lack of oxygen supply kay baby, or any other types of neonatal distress that may warrant relaxation of the rectal sphincter. That should not happen. Anyway, that's another MCN2 topic. But you just need to know that ang ihi, inilalabas na yan, okay lang, that's normal, fetus. Pero pag meconium, hindi dapat naglalabas ng fetus. Ang fetus ng meconium. Not until birth. Also, there's a definite sleep and activity pattern. Nararamdaman na nung nanay kung kailan tulog yung baby, mamaya gigising na to. So, nararamdaman na siya ni mommy sa loob. 6th lunar month, so mas lumalaki, kalahating kilo na yung baby halos. Vernix caseosa is produced. Vernix caseosa is a cream cheese-like substance covering the baby's skin. No? Initially, ang vernix caseosa, ang function niyan ay para mag-give birth easily. Madulas kasi yung balat ng baby. So, dahil madulas, cream cheese-like substance, easier passage as the baby is being born. Pagka-pass through niya from the pelvic bone down to the vagina of the mommy. But aside from that, it allows easy passage of the baby during birth. Vernix caseosa is also a good thermoregulator. So tumutulong siya na nakakapag-regulate ng body temperature ng newborn. Okay? Also in the 6th lunar month, napoproduce actively ang lung surfactant. Lung surfactant is a phospholipid na naglaline ng alveoli. Okay? At ang purpose ng lung surfactant, it's for better expiration. Okay? Nape-prevent yung alveolar surface tension, especially when we exhale. Alright? And when a newborn does that, hindi nagkakaroon ng lung collapse. Ang ating alveoli, if you look at my fingers, here. Inhale, exhale. Inhale, exhale. Hindi dapat totally na-deflate yung alveoli. Hindi dapat siya ganito na inhale, exhale, inhale, exhale. Hindi ganon. Dapat inhale, exhale. Inhale, exhale. Okay, so between the two, which is correct? Inhale, exhale, inhale, exhale. It should be this one. Meaning, hindi totally na-deflate. Pag totally nag-deflate during expiration like this, instead of just like this, no, may natitira sa loob, maglalang collapse. Alright? At nangyayari yon kapag kulang ng surfactant. It's actively produced in 6 months, pero nakukumpleto halos siya by the end of the 8th to the 9th month. Halos. So, halos papunta na sa term. Doon lang nakukumpleto yung surfactant. Okay? LS ratio or lecithin-sphingomyelin ratio determines if the alveoli is mature. Okay? 2:1. It is completed at term. Initially, ang lecithin-sphingomyelin ratio ay 1:2. Baliktad, no? 6 lunar month, mga 1:2 pa yan. Pero pag nagkabaliktad na, mas marami na yung isa, no, 2:1 na siya, lecithin versus sphingomyelin, term na. So, initially, 1:2, magiging 1:1, naungusan na siya, naging 2:1 na, no? So, yun yung term. Pero nag-uumpisa yan at 6 months. Also, at 6 months, the eyes can open. 7 months, so length, weight, mas mabigat na siya sa 1 kilo, lung alveoli begin to mature. So, nung 6 months, nag-uumpisa pa lang ma-produce yung lung surfactant. 7 months, begin to mature. Pero hindi pa totally mature. Kaya ang problema sa lahat ng bata na ipinapanganak ng kulang sa buwan, ang unang-unang problemang nakikita natin is the lung alveoli. They would definitely require oxygen therapy or oxygen support. Okay? Sa lalaki, the testes begin to descend. Dapat ang testes bumababa. Undescended testes, cryptorchidism. It may have problems future infertility. Another, at the 7th month, no, blood vessels of retina are extremely susceptible to damage from high oxygen concentrations. Ano yung significance nito? Pag pinanganak yung baby ng 7 months, ano nga yung magiging problema sa kanya? Baka magka-problema siya sa paghinga, airway, lungs, respiratory system. Kasi nga alveoli is immature. Diyan pa lang halos nagmamature. So, anong ibibigay na intervention doon sa baby na pinanganak ng preterm or kulang sa buwan? Oxygen. Anong karakteristik ng retina daw? Pag ganyan ang edad, retina is extremely susceptible to damage from high oxygen. So, yung mga batang pinanganak ng kulang sa buwan na binigyan ng oxygen, isa sa nagiging komplikasyon noon, nagkakaproblema sila sa retina. Okay? Or sa eyes. Or sa mata. Okay? 8 lunar month, 38 to 42 cm, 1,600 grams na, fats begin to be deposited. So, dyan na lumalaki yung mga subcutaneous fats. Nagiging maganda na yung balat nila, nagiging chubby na yung itsura nila. Fetus aware of the sounds outside. Very strong na yung kanilang hearing. No? So, especially when parents talk to the fetus can actually hear the voice of the parents already. Another reflex that is present and active, motor reflex. Yung motor reflex, no, again, reflexes check how well or how effective the neuromuscular system is. So, yung motor reflex, kapag may loud sound or loud voice, para bang nagugulat yung baby or fetus, nag-extend yung kamay at paa niya. No? So, dahil nga very strong na yung hearing ng fetus, may moro na rin sila dun sa loob ng uterus ni mommy. 9th month, may mga buntis na nanganganak na ng 9 months. Okay? Lanugo, it diminishes. Again, para saan nga yung lanugo? Fine downy hair, mga buhok, extra buhok, nawawala na dapat yan. Kasi nga, napapalitan na siya ng subcutaneous fats, di ba? Kasi yung buhok na yon for thermoregulation lang naman siya. Kaya pag pinanganak yung baby na may lanugo, sign siya ng prematurity. Okay, 9 months din, nag-vertex or head-down presentation na. Pinipwesto na nila cephalic, no, yung ulo, nandoon sa point ng vagina, getting ready for birth. Normally, the presentation is cephalic. If not, it may warrant cesarean section. 10th month, may mga buntis na hindi na umaabot ng 10th month. Kasi 37, 38, 39, pwede na silang manganak. Okay? So, fetus kicks actively at this time. At 10th month, yung hemoglobin, nagtatransform na into adult hemoglobin. Nung fetus sila, fetal hemoglobin is alpha and gamma. Pero yung adult hemoglobin, alpha and beta. Okay, magkaiba yon. Ang fetal hemoglobin na alpha and gamma, ang buhay niya 90 days lang. Ang adult hemoglobin, yung hemoglobin natin, no, ang buhay nito, pag nagbe-breakdown ng hemoglobin, 120 days. Okay? Tapos may mga sakit na ang problema, the beta chain of hemoglobin. Ang fetus, no, pag pinanganak, doon pa lang nagiging adult. Completely nagiging alpha and beta at 6 months old. So, yung 1-month-old baby, halos wala pa siyang enough beta hemoglobin. May mga sakit na beta hemoglobin ang dahilan. For example, another MCN 2 topic ito, for example lang, sickle cell anemia. Sickle cell anemia is a problem of the beta chain of hemoglobin. So, you cannot diagnose a 2-month-old baby of sickle cell anemia because of the fact na wala pa naman siyang adult hemoglobin completely at that time. Kasi natatransform lahat ang adult hemoglobin approximately 6 months after birth. Okay, vernix caseosa fully formed, sole creases, 2/3 of the foot surface. So, yung mga guhit sa talampakan and lightening is felt. What is lightening? Other term for lightening is engagement. Ibig sabihin nun, nagsisettle down na yung presenting part ni baby sa level ng ischial spine. When you say ischial spine, para siyang nag-anchor na, angkla ng pelvic bone ni mommy, getting ready for birth. Ibig sabihin lang nun, may mga buntis na hindi nakakaramdam ng lightening. Lalo na kung ang lightening madalas nangyayari sa 10th month. Okay? Now, these are some terms that we have to know, no, and you have to memorize and identify what these terms are when we talk about pregnancy status. Okay, para means pagbubuntis na naging viable regardless of whether the infant were born or alive or not. So, para basta naging viable. Gravida, basta nabuntis. Primigravida, first time na nabuntis. Primipara, first time na nabuntis at yung pagbubuntis niya ay viable na. Multigravida, maraming beses nang nabuntis. Multipara, maraming beses nang nabuntis na umabot ng viability yung pagbubuntis. And nulligravida, never pang naging pregnant. Okay?